Okay, this is right testicle. The blood is coming into testis nicely, and the blood vessels coming to testicle, they are not very thick. In a normal man, artery maybe around 1 millimeter. Let me show you. I saw 2 arteries. Okay, this is one of them. This is the thickness of artery, small. The veins must be like this, maybe 2 millimeters. If it is more than 3 millimeters, it is varicocele and it hits the testicle, and it's a problem. I show you the right testis to understand how is the normal structure. This is right testis. These are the vessels. It has spermatic cord, which has artery, veins, and the sperm channel inside. And we cannot see very nicely because they are very thin. When we look to your left side, look at this one. This is something not normal. The testis is buried between the veins. It is buried down there. Testis, right testis is trying to come here. And look at these vessels. These are abnormal. People ask me, what will happen if you take out these veins? Where will the blood go from? These are abnormal. These are harmful. These are dangerous. So we don't need these. We need just a little tiny 2 millimeter vein. This is too big. Look at, there is blood flow inside. This blood flow, like a radiator, heats up the testicle. And this is harmful, dangerous. It ruins the testicle. It destroys the testicular cells. So when I take it out, there are many small tiny vessels here, no problem. And around the vas deferens, there are good veins which never become dilated, never become varicose. So these must go. In a normal procedure, not in Istanbul varicocelectomy, they also aim in conventional varicocele operation or in embolization. They also aim to get rid of these veins. They ligate the vein from some part and hope the rest of the vein will disappear by time. But in 70% of the cases, it disappears nicely. But in 30% of the cases, it doesn't disappear. I understand this when I look with ultrasound to my patients. I see there were many people after the procedure. There is the ligated vein. Rest of the vein is staying there, not disappearing. I said, oh, what's going on? And my patients also see why this vein didn't go away. So we talk to our vascular surgeons and ask what is going on, what shall we do? They say, okay, in conventional varicocele operation, you are ligating the vein and hoping this will disappear. Don't wait. They said, take it out immediately. So I begin to take it out immediately, and this is a new technique. This is not done in any part of the world, with any urologist, because urologists do not use this Doppler device. They just do physical examination, and if after the procedure they don't do any Doppler investigation very frequently like me. So I understand if you take this out, the results will come immediately. The vein will go immediately, and the results are really different. First, pain goes immediately. Pain, if the patient has pain, it goes immediately.
You don't have any pain.
You don't have any pain. You are doing it for sperm reasons, for child, having child. You have a baby, it is nice. And we call it secondary infertility. If you have one baby and having problem in the second one, this is secondary infertility. And most important, most common reason is varicocele for secondary infertility. Also the childbirth results are much better with this procedure. At least it doesn't recur. I have also recurrence, but it's very, very low, like 3%. And the sperm counts increase more rapidly, because in normal conventional operation, when you ligate it here and wait for it to disappear, it will not disappear next day. It will not disappear 1 week later. Maybe 1 month, maybe 3 months, maybe 6 months. So the healing will be after some certain periods, maybe 1 month, maybe 3 months. And you have to wait. But in my procedure, second day after the operation, you are cured. So sperm production begins immediately. And a sperm is produced in 90 days, 3 months roughly. But after our operation, first day after the operation, new sperm production will begin. And we usually have the results around 6th month. So let me see how is it with Doppler colors. Oh, look. When I push the Doppler, in the right side, I just see arteries, 1 millimeter, very thin. But in this side, you are not straining now. You are not pushing, you are not coughing. You are standing in a normal position, with relaxed position, and still you have these reflux. This is abnormal. This is the reason your sperms are affected with varicocele. So, when I look here, this is really too much reflux. There is a common mistake. Radiologists sometimes measure the diameter with these colored images. It is not true. For example, here 4.5. But if I clean the color, look, it may be smaller. I put the color again. Sometimes it is true, but sometimes, for example, here, there is a very large color, and when I measure it, so I recommend people to be very careful, especially after the procedure. They say, oh, there is recurrence greater than 3 millimeter varicocele. Here we see 5.7, but when we disappear the color, this is not the real vein. So it must be, diameter must be calculated like this in the gray scale. Color Doppler may look, and strain, please see what's happening when you strain. Push your abdomen, strain, or cough like okay. So look at the cough, you have really big amount of reflux. So our physical examination is like this. We do normal physical examination, and I look with Doppler. Look, here it is very much color, but when I take out the color, still there is a big varicocele. Let me calculate the diameter. The most important, it has continuous reflux, so it is near 5 millimeters again. You have a big varicocele. This is the reason of your secondary infertility. You had 1 baby. Congratulations, mashallah. And inshallah we will have the second soon. Okay.